My name is Craig Lockhart. I'm a medical oncologist. I practice at the Medical University of South Carolina. I focus on taking care of patients with gastrointestinal cancers, and I have a particular interest in taking care of patients with esophageal and gastric cancers. I've been taking care of patients with esophageal and gastric cancers for approximately 20 years. Once somebody is diagnosed with esophageal cancer, the staging requires a multidisciplinary team. Initially, there will be the endoscopy, and the endoscopy gives us the location of the cancer, and that's usually where the biopsy comes from. That's usually how the diagnosis is made. Then quite often there is some kind of imaging that's performed. Sometimes it's a CT scan, sometimes it's a PET scan, sometimes it's both. And that gives us an idea about whether the cancer has spread or not. If the cancer has spread, quite often we want a diagnostic biopsy to one of these areas that the cancer has spread to confirm that one way or another. Because if the cancer has spread, we want to know for sure. We don't want just to base that information specifically on radiology, because sometimes radiology can provide false positive results or sometimes false negative results. And so quite often we'll want to do a biopsy. If the PET scan or the CT scan is particularly definitive, sometimes we'll accept that without a biopsy. If the cancer has not spread based on imaging, then usually the next test that we would order is an endoscopic ultrasound. So that's just like an endoscopy, except it has an ultrasound probe, and it'll give you a better idea about the size of the tumor and whether there are any lymph nodes that are involved, that look like they're involved with cancer. An ultrasound is relatively accurate with that, in that lymph nodes under ultrasound look a certain way if they're malignant and look a different way if they're not malignant. So those are the three staging things that we do: the upper endoscopy, the CT scan and or PET scan, and then endoscopic ultrasound. At the end of all of that, we should have a pretty good idea of what stage cancer we're dealing with and what the next step in treatment should be.